with Binod Sir YouTube channel. Today we will discuss about the obstetric surgical instruments. In this video, you will learn the name of the instruments and their uses. The name of the catheter is simple rubber catheter. Simple rubber catheter, it is used to empty the bladder in cases with retention of urine. 1. During A. Pregnancy, retroverted gravid uterus. B. Labor I. When the woman fails to pass urine by herself. 2. Before and after any operative interventions. C. Postpartum I. During management of postpartum hemorrhage. 2. Retained placenta. 2. Other uses. A. As a tourniquet. B. To administer O2 when nasal catheter is not available. C. As a mucus sucker, when it is attached to a mechanical or electric sucker. The name of the catheter is Foley's catheter. Foley's catheter, it is used for continuous drainage of bladder in cases with I. Eclampsia. 2. Retroverted gravid uterus. 3. To give rest to the bladder following any destructive operation, and or in a case with suspected bladder injury. It is usually kept for 7 to 10 days. 4. In the management of atonic PPH. V. To control atonic PPH. The catheter is inserted within the uterine cavity and the catheter balloon is inflated with normal saline. The balloon provides a tamponade to the uterine surface. The catheter drains the blood from the uterine cavity if there is any. The name of the instrument is Sims double-bladed posterior vaginal speculum. Sims double-bladed posterior vaginal speculum. The blades are of unequal breadth to facilitate introduction into the vagina depending upon the space available, narrow blade in nulliparous and the wider blade in parous women. The uses of Sims double-bladed posterior vaginal speculum as follows. 1. To inspect the cervix and vagina and to detect any injury following delivery. 2. To clean the vagina following delivery. 3. To inspect the cervix and vagina to exclude any local cause for bleeding in APH, Cusco's speculum preferred. 4. During D and E operation. The name of the instrument is Cusco's bivalve self retaining vaginal speculum. The uses of Cusco's bivalve self retaining vaginal speculum as follows. I. To visualize the cervix and vaginal fornices for any local cause. Polyp ectopy of APH. 2. To inspect the cervix and to prepare cervical smear for cytology. Screening. 3. To detect leakage of liquor from the cervical OS in a case of suspected prom. The name of the instrument is multiple-toothed valcellum. The uses of multiple-toothed valcellum as follows. 1. It is used to catch hold the anterior lip of the cervix in A. B plus E operation. B. Suction evacuation. 2. As it produces trauma to the soft and vascular cervix, Alice tissue. Forceps is used instead. The name of the instrument is Alice tissue forceps. The uses of Alice tissue forceps as follows. 1. To catch hold the anterior lip of the cervix in D plus E operation. 2. To hold the apex of the episiotomy wound during repair. 3. To catch hold of the margins of the peritoneum, rectus sheath. Vaginal mucosa during repair. 4. To catch hold of the torn ends of the sphincter aniexternus prior to suture in repair of complete perineal tear. 5. To catch hold the margins and angles of the uterine flaps in LSCs after the delivery of the baby as an alternative to green hermitage. Hemostatic clamp. The name of the instrument is long straight hemostatic forceps. The uses of long straight hemostatic forceps as follows. 1. This is not commonly used in obstetrics. 2. It can be used to clamp the pedicle while removing the uterus, as in rupture uterus. The umbilical cord may be clamped as an alternative to Kocher's. The name of the instrument is Kocher's hemostatic forceps. The uses of Kocher's hemostatic forceps as follows. 1. To clamp the umbilical cord for better grip and effective crushing. Effect to occlude the vessels. 2. In low rupture of the membranes as surgical induction of labor or augmentation of labor. The name of the instrument is long straight scissors. The uses of long straight scissors as follows. It is commonly used to cut the umbilical cord. 2. To make episiotomy. 3. To cut suture materials as in caesarean section. The name of the instrument is uterine sound. The uses of uterine sound as follows. It is an olive-pointed, graduated, malleable, metallic uterine sound. To know the position of the uterus and the length of the uterine cavity prior to dilatation of the cervix in D+E operation. 2. To sound the uterine cavity to detect any foreign body, IUCD. 3. It acts as a first dilator of the cervical canal. The name of the instrument is Hockenambler and Das or Hager's dilators. The uses of Hockenambler and Das or Hager's dilators as follows. It is used in dilatation of the cervical canal prior to evacuation. Operation. Degree of dilatation required. Incomplete abortion, sufficient to introduce the index finger. Usually 16/19. 2. In suction evacuation, one size smaller than the size of the suction cannula. 3. In NTP by D+E, sufficient dilatation to introduce ovum forceps. Usually 9/12. The name of the instrument is flushing curette. The uses of flushing curette as follows. It is a blunt curette used in the operation of D+E. Previously, it was used to flush the uterine cavity with lukewarm antiseptic solution passing through the communicating channel. The name of the instrument is Doyer's retractor. The uses of Doyer's retractor as follows. 1. It is used to retract the abdominal wall as well as the bladder for proper exposure of lower uterine segment during LSCS. 2. It is to be introduced after opening the abdomen, to be temporarily taken off while the baby is delivered, to be reintroduced after delivery of the baby and finally to be removed after toileting the peritoneal cavity. The name of the instrument is sponge holding forceps. The uses of sponge holding forceps as follows. 1. Toileting the vulva, vagina and perineum prior to and following delivery. 2. Antiseptic painting of the abdominal wall prior to cesarean section. 3. To catch hold the membranes if it threatens to tear during delivery of the placenta. 4. To catch hold the cervix, 2 pairs are needed for inspection in suspected cervical tear. 5. To catch hold the cervix during encirclage operation. Ovum forceps are specialized medical instruments mainly used in gynecological procedures. They are designed to handle delicate tissues within the female reproductive system, such as the ovum and placenta. The uses of ovum forceps are as follows. 1. Fertility treatments. Ovum forceps are crucial in assisted reproductive technology, ART, procedures like in vitro fertilization, IVF, and intracytoplasmic sperm injection, ICSI, where they help in the retrieval of eggs from the ovaries. 2. Caesarean sections. During C-sections, they assist in handling the uterine tissues and placenta safely. 3. Uterine repairs and hysterectomies. Ovum forceps help in grasping and manipulating tissues during these surgeries. 4. Tubal ligations. They are used for blocking the fallopian tubes in sterilization procedures. The name of the instrument is uterine curette. The uses of uterine curette are as follows. 1. Dilation and curettage. D&C. The curette is used to remove tissue from the uterine lining for diagnostic or therapeutic purposes, such as after a miscarriage or for removing excessive uterine bleeding tissue. 2. Endometrial biopsy. It is used to take a sample of the uterine lining to diagnose conditions like endometrial cancer or investigate abnormal uterine bleeding. 3. Uterine polyps removal. The curette helps in removing polyps from the uterine lining, which can cause irregular bleeding or other issues. 4. Management of miscarriage. It helps in removing retained products of conception following a miscarriage. 5. Treatment of postmenopausal bleeding. In postmenopausal women, the curette is used to clear the uterine cavity for hysteroscopy or other diagnostic procedures. 6. Aspiration of retained placenta. Following childbirth, it assists in removing any retained placenta pieces to prevent infection or excessive bleeding. 7. Diagnosis of irregular menstrual periods. By scraping the uterine lining, it can help identify reasons for irregular menstrual cycles. The name of the instrument is uterine dressing forceps. The uses of uterine dressing forceps is as follows. 1. Placing and removing dressings. These forceps are commonly used to place and remove dressings in the uterine cavity. 2. Manipulating tissues. They help manipulate delicate uterine tissues during various surgical procedures. 3. Grasping and holding tissues. The serrated jaws of these forceps securely grasp and hold tissue to prevent slipping. 4. Hysteroscopy. Uterine dressing forceps are used in procedures like hysteroscopy to handle uterine tissues. 5. Dilation and curettage. D&C. They assist in the curettage of the uterine lining. 1. 6. Endometrial biopsy. They help secure and manipulate tissues during endometrial biopsy procedures. 7. Myomectomy. Used in myomectomy to hold and manipulate tissues. 1. 8. Ovarian cystectomy. They assist in procedures like ovarian cystectomy by securely grasping tissues. The name of the instrument is laminaria tent and the tent-introducing forceps with laminaria tent. The uses of laminaria tent and the tent-introducing forceps with laminaria tent is as follows. Laminaria tent. 1. Cervical dilation. Laminaria tents, derived from seaweed, are used to gradually dilate the cervix by absorbing fluids, which helps it expand. 2. Abortion preparations. They are often inserted a day before surgical abortion procedures to ensure the cervix is dilated for safe and effective procedure. 3. Induction of labor. Laminaria tents can help induce labor by gently opening the cervix, although they are less commonly used today due to potential infection risks. 4. Endometrial sampling. They aid in dilating the cervix to facilitate procedures like endometrial biopsy. 5. Miscarriage management. Assist in dilation when preparing for procedures following a miscarriage. Tent introducing forceps. 1. Insertion of laminaria tents. These specialized forceps are used to accurately place laminaria tents within the cervical canal. 2. Secure handling. They provide a firm grip, ensuring the laminaria tent is properly positioned without causing trauma to the cervix. 3. Minimizing risks. Helps in minimizing the risk of infections by providing a controlled and sterile means to insert tents. 4. Multi-step procedures. useful in cases where multiple laminaria tents need to be inserted over 1 or 2 days to achieve desired cervical dilation. The name of the instrument is manual vacuum aspiration, MVA, syringe. The uses of manual vacuum aspiration, MVA, syringe is as follows. 1. Incomplete abortion management, MVA is used to evacuate the uterine contents in the case of an incomplete abortion before 13 weeks of gestation. 2. Molar pregnancy management, it's used to remove abnormal tissues associated with molar pregnancies. 3. First trimester abortion, MVA is employed for terminating a pregnancy in the first trimester. 4. Uterine biopsies, the syringe helps in obtaining endometrial biopsy samples for diagnosing abnormal uterine conditions. 5. Evacuation of retained products of conception, helps clear the uterus of any retained products after miscarriage or birth. 6. Treatment of post-abortion complications, MVA addresses complications like excessive bleeding or incomplete evacuation. 7. Diagnostic procedures, it is sometimes used for diagnostic purposes, such as in cases of unexplained irregular bleeding. The name of the instrument is plastic suction cannula. The uses of plastic suction cannula is as follows. 1. Suction and evacuation, used for the evacuation of abnormal fetuses and for addressing instances of miscarriage or spontaneous abortion. 2. Manual vacuum aspiration, MVA utilized during the first trimester for safe surgical abortions. 3. Dilation and curettage, D&C helps in scraping and suctioning tissues during D&C procedures. 4. Less tissue damage, designed to cause less damage to the uterine wall compared to metal cannulas. 5. Biopsy procedures, used in conjunction with MVA syringes to assist in endometrial biopsies too. 6. Sterile and single-use, ensures minimal risk of infection as these cannulas are sterile and made for single use. The name of the instrument is long curved obstetric forceps. The uses of long curved obstetric forceps is as follows. 1. Assisted vaginal deliveries. Long curved obstetric forceps are used to assist in vaginal deliveries, especially when the baby's head needs gentle guidance through the birth canal. 2. Cephalic presentation. They help in deliveries where the baby is in a cephalic, head-first, position. 3. Reducing delivery time. They are beneficial when the second stage of labor is prolonged, helping reduce delivery time. 4. Maternal exhaustion. These forceps can be used when the mother is too exhausted to push effectively. 5. Fetal distress. In cases where the baby is in distress, forceps can quickly facilitate delivery to ensure the baby's safety. 6. Breech deliveries. Long curved forceps are sometimes used to assist in breech deliveries, especially if the baby's head has already passed too. 7. Complication management. They are used to manage complications like shoulder dystocia, wherein they help maneuver the baby's body to ensure a safe birth. 8. Reducing cesarean deliveries. By enabling assisted vaginal delivery, these forceps help avoid the need for cesarean sections, thus reducing associated risks and complications. The name of the instrument is short curved artery forceps. It is also known as hemostatic forceps or clamps, are surgical instruments commonly used in various medical procedures. Their primary uses include 1. Hemostasis. To clamp blood vessels and control bleeding during surgeries or procedures. 2. Tissue grasping. To hold or manipulate delicate tissues without causing damage. 3. Suturing assistance. To assist in holding tissues or sutures while suturing. 4. Wound closure. To grasp and close small blood vessels or tissues before tying ligatures. 5. Dissection. To separate tissues in surgical fields, particularly in confined or curved areas. 6. Foreign body removal. To extract foreign objects from bones or body cavities. The name of the instrument is key-lens forceps. The uses of key-lens forceps is as follows. 1. Rotational assisted vaginal deliveries. These forceps are primarily used to rotate the fetal head in cases of malposition, helping the baby to pass through the birth canal more easily. 2. Deep transverse arrest, addressing situations where the fetal head is arrested in transverse position in the birth canal. 3. Prolonged second stage of labor, used when labor has been prolonged to assist in a safe vaginal delivery. 4. Reduction in caesarean sections. By facilitating the successful rotation and delivery of the fetal head, they can reduce the need for caesarean sections, especially in fully dilated scenarios. 5. High station deliveries, used for deliveries where the fetal head is at a higher station and needs to be brought down. 6. Malpresentation, helps to correct malpresentation. The name of the instrument is forceps axis traction devices. The uses of forceps axis traction devices is as follows. 1. Correct traction direction. These devices guide the forceps to apply traction along the birth canal's axis, ensuring safe delivery by minimizing tissue trauma. 2. High and mid forceps deliveries. They are essential in high and mid forceps deliveries to apply downward and backward traction effectively. 3. Reduction of perineal tears. By ensuring accurate traction direction, these devices help reduce the risk of perineal tears and injuries. 4. Assists in rotational movements, enables controlled and precise rotational movements of the fetal head, which is crucial for managing malpresentations. 5. Facilitates smooth delivery, helps in manually guiding the baby's head through the birth canal during difficult deliveries, thereby reducing delivery time. 6. Helps in forceps maneuvering, provides better control and maneuverability of the forceps, which improves the safety and efficacy of the procedure. The name of the instrument is episiotomy scissors. The uses of episiotomy scissors is as follows. 1. Perineal incisions during childbirth. Episiotomy scissors are used to make precise, controlled incisions in the perineum during childbirth, aiding in the baby's delivery by enlarging the vaginal opening. 2. Preventing uncontrolled tearing. These scissors help prevent severe and uncontrolled tearing of the perineal tissues during labor, promoting quicker and cleaner incisions. 3. Assisting instrumental deliveries. They are used during instrumental deliveries, example, forceps or vacuum deliveries, to create adequate space for safe passage of the baby. 4. Minimizing trauma. By providing controlled cuts, episiotomy scissors minimize trauma to perineal tissues, leading to faster healing. 5. Emergency situations. Essential in emergency obstetric procedures where a quick and precise incision is needed to ensure the safety of both mother and baby. The name of the instrument is ventouse cup with traction device. The uses of ventouse cup with traction device is as follows. 1. Assisted vaginal delivery. The ventouse cup is used to aid in the vaginal delivery of babies, especially when mothers face difficulty in pushing the baby out. 2. Prolonged labor. It is beneficial during prolonged labor to expedite the delivery without resorting to caesarean sections. 3. Malpositioned fetus. The ventouse cup can help in deliveries when the baby is in a less than ideal position, such as the occiput posterior or occiput transverse positions. 4. Reducing maternal exhaustion. This device assists mothers who become exhausted during labor, helping to avoid further complications. 5. Minimizing perineal tears. Compared to forceps, The venous cup often results in fewer perineal tears and a lower risk of maternal trauma. 6. Controlled traction. It allows controlled and gentle traction to guide the baby's head through the birth canal. The name of the instrument is Green Armitage Hemostatic Forceps. The uses of Green Armitage Hemostatic Forceps is as follows. 1. Maintaining hemostasis. These forceps are used to control bleeding by clamping blood vessels or tissues during surgeries, ensuring a bloodless surgical field. 2. Caesarean sections. They are commonly used in caesarean sections to grasp and hold uterine tissues, assisting in safely delivering the baby. 3. Hysterectomies. In hysterectomy procedures, Green Armitage forceps help clamp and secure tissues, making the operation more efficient. 4. Grasping uterine ligaments. The forceps are used for securely grasping uterine ligaments during various gynecological surgeries. 5. Postpartum hemorrhage management. They are invaluable in managing postpartum hemorrhage by providing effective and reliable clamping of uterine arteries. 6. Versatile use in other surgeries. Despite being primarily designed for obstetrics, these forceps are also adaptable for vascular surgeries and other medical fields where hemostasis is critical. The name of the instrument is mucus sucker. The uses of mucus sucker is as follows. 1. Clearing nasal congestion. Mucus suckers help remove excess mucus from the nasal passages, especially in infants who can't blow their noses, improving their breathing. 2. Symptom relief from colds. Used to alleviate symptoms of colds by removing mucus buildup, reducing discomfort, and making breathing easier. 3. Post-surgical care. Helps clear mucus in patients recovering from surgeries, thereby preventing respiratory complications. 4. Managing respiratory conditions. Assists individuals with respiratory conditions like sinusitis or bronchitis by clearing mucus from nasal and oral cavities. 5. Infant care. Essential in pediatric care to keep the airways of babies clear of mucus, ensuring they can breathe properly and comfortably. 6. Preventing infections. Regular use prevents mucus buildup which can otherwise lead to infections. The name of the instrument is cord clamp. The uses of cord clamp is as follows. 1. Umbilical cord clamping. Cord clamps are used to clamp the newborn's umbilical cord immediately after birth to stop the flow of blood between the baby and the placenta. 2. Prevention of bleeding. They prevent bleeding from the umbilical stump, ensuring safety until the cord dries and falls off naturally. 3. Instrumental in delayed cord clamping. In delayed cord clamping, they are used after a specified period post-birth to allow additional blood flow from the placenta to the baby, providing extra nutrients and iron. 4. Securing the cord. Used in securing the cord stump safely, minimizing the risk of infection. 5. Postpartum hemorrhage control. Helps in managing postpartum hemorrhage by ensuring any excess bleeding is controlled during childbirth. The name of the instrument is Pinard's stethoscope. The uses of Pinard's stethoscope is as follows. Fetal heart rate monitoring. The primary use is to listen to the fetal heart rate during pregnancy. It helps healthcare providers assess the health and well-being of the unborn baby. The name of the instrument is perforator, Oldham's. The uses of perforator, Oldham's, is as follows. The instrument is required in craniotomy to perforate the skull bone for decompression of the fetal head.